So the next meridian we're going to look at is the spleen meridian. So the full name of this meridian is the spleen meridian of the foot taiyin. So once again, from the name, we can get a lot of information. Firstly, we know that it's a foot yin meridian. What this tells us is that all the yin meridians travel from the feet up to the chest. So we know this meridian is going to do the same. And then because it's taiyin, that tells us another important aspect of the flow. Firstly, that it's on the medial aspect of the legs. And then one thing we got to note here is that there's a slight change in how this meridian flows compared to the meridians on the hand. So if you look at this image I've just brought in, the spleen meridian is actually in the middle of the 3 yin meridians, up until about 8 sun above the medial malleolus, so that's around here, and then it will become the most anterior of the 3 yin meridians. And then there is a total of 21 points on this meridian, and the common indications between points are for diseases related to the spleen. So remember here, when we talk about the spleen, we're talking about the spleen as a zangfu organ. So this is related to any type of dysfunction of the digestive system, such as epigastric pain, diarrhea, etc. Then secondly, it can also be used for gynecological disorders, such as metorrhagia. And thirdly, it can be used for any other diseases related to where the meridian flows on the body. Next, we're going to look at the course that this meridian follows. So this meridian starts at the tip of the big toe at spleen 1 on the medial portion of the big toe, so that's down here. And then it runs along the medial aspect of the big toe and then the medial aspect of the foot at the junction of the red and white skin. It continues to flow like this until it reaches just anterior to the medial malleolus, where it then ascends in front of the medial malleolus and ascends up the lower leg. And then on the lower leg, it ascends just posterior to the medial aspect of the tibia and continues ascending all the way up the medial aspect of the knee and the medial aspect of the thigh. It continues ascending to the abdomen up here. And then what it does here is it does something different to a lot of other meridians. It moves medially to connect with both Rin 3 and Rin 4, which is these 2 points. And then after this, it continues laterally back to the 4 Tsun lateral to the midline mark, which is over here. It then continues ascending until this region over here, where it then once again moves medially again to connect now with Ren 10 on the midline, which is this point. And then it has one branch that goes off here, but the main branch continues laterally again back to the 4 Tsun lateral to the midline mark, which is this mark. And it continues ascending up to just below the nipple, where it will move laterally again to the 6 Tsun lateral to the midline mark and continue ascending 6 Tsun lateral to the midline. And during this ascending pathway, it will pass through the gallbladder, the liver, and the lung meridians. Once it reaches near the shoulder up here, it once again loops back down and goes all the way down to the 7th intercostal space at the mid-axillary line, which is over here, where the meridian ends. There are 2 major branches on this meridian. The first branch is in blue over here, and this branch separates the meridian around Ren 10, and it moves more interiorly, where it connects with its associated organ, the spleen, and its partner organ, the stomach, and then continues ascending through the diaphragm and all the way up to connect with the heart. The second branch occurs up here at the shoulder region, where this branch separates from the main meridian and continues ascending along the chest, moving medially to the throat and ascending up the esophagus to the lower border of the tongue, where it spreads all over this region. So in this slide, we're going to look at the course the meridian flows on the chest and abdomen. So this is going to be important as it will help you locate 18 of the spleen meridian's points. As just like the stomach meridian, the points on the spleen meridian on the chest and abdomen all share similar distances from the midline. So knowing this pathway will assist you in finding all of these points. So firstly, we will find the anterior midline, just like in the stomach meridian. And then we're going to locate the medial end of the clavicle and its lateral end, and then find the midpoint of these 2 points, which is the midpoint of the clavicle over here. And then what we're going to also do is go from the midpoint of the clavicle and the lateral end of the clavicle and find that midpoint, which is over here. And what this now has given us is that the first marker, the midpoint of the clavicle, that's our 4 tsün mark. And then our second mark over here will be 6 tsün lateral to the midline, as it's half of the distance from here to here, which is 2 tsün. Next, then we're going to find the umbilicus once again, and we're going to find our sternocostal angle up here. We're going to divide this in half to get 4 tsün superior to the umbilicus. And then what we know is the meridian starts on the lower abdomen, 4 tsün lateral to the umbilicus over here. And then at the 4 tsün above the umbilicus mark, it's going to start moving laterally to the 5th intercostal space over here. And then it's from the 5th intercostal space, it's going to run 6 tsün lateral to the midline. So what this means is that the points from spleen 13 to 16, which is from here to here, will all be 4 tsün lateral to the midline, whereas the points from spleen 17 to 20, which 17 is around here and 20 is up here, will all be 6 tsün lateral to the midline. And then I've also brought in the stomach meridian's pathway as a reference so you can see the difference between the 2 pathways. Firstly, the spleen meridian runs from the lower abdomen up to the chest, whereas the stomach meridian ran from the clavicle up here all the way down to the lower abdomen. And then the other big difference was the spleen meridian was 4 tsün up here and 2 tsün down here, whereas the spleen is 4 tsün down here and 6 tsün up here on the chest. And then in this slide, we're going to just discuss in a bit more detail how we locate the sternocostal angle. So what is the sternocostal angle? Well, if we break down the name, sternal refers to the sternum, this part over here, and then costal refers to the costal cartilages that join the ribs to the sternum, which are these over here, and also over here on this side. So we're looking at the junction between the sternum and the costal cartilages. So that's referring to this region down here. And how we locate this region is we first palpate on the patient at the lower border of the rib cage over here and here, and then we follow these lower borders up to where they join to the sternum, which will be around this region, and that's our sternocostal angle. One thing you must be careful here is not to locate the tip of the xiphoid process. So from the sternocostal angle, what happens is there's a little bone that protrudes downwards from the sternocostal angle. And when palpating in some individuals, it might be difficult to differentiate between the two. So you must ensure you're at the point where the rib cage joins the sternum and not this tip here. And then the frequently used points on the spleen meridian. So these are spleen 1, Yinbai, spleen 4, Gongsun, spleen 6, Sanyin-jiao, spleen 9, Yinling-quan, and spleen 10, Shu-chai. So the first point on this meridian is Yinbai, spleen 1. This is a Jingwell and Wood point of the meridian, and it is located on the medial side of the big toe, 0.1 tsün posterior to the medial corner of the nail. So we find the medial end of the nail over here, and then we find the posterior border of the nail. And at the junction of these 2 points around here, we have to go 0.1 tsün away from this. So we're just off of the nail bed in this region. This point can be used for metorrhagia, hematochezia, melena, hematuria, mental disorders, excessive dreaming, infantile convulsions, and abdominal distension or sudden diarrhea. Our insertion is a perpendicular shallow insertion 0.1 tsün, or we can prick this point to bleed. We can also use moxibustion on this point. The next point is Dadu, spleen 2. This is the Xing spring and fire point of the meridian. And this point is located on the medial side of the foot, distal and inferior to the first metatarsal phalangeal joint, at the junction of the red and white skin. So this image here shows the medial view of the foot. So we first have to locate the first metatarsal phalangeal joint. So here's the metatarsal, this bone here. These are the 2 phalanges. So the junction between the two is this region here. And then it says that we must be distal and inferior to this joint. So that means we have to go in this direction. So what we are looking for is that depression at the junction of the red and white skin. So remember we talked about this red and white skin before. So if I bring in an image here, if you look at this image, what you can see, it might be quite difficult to see, but there is a faint red outline here. And if you follow this, you can see it going all the way here on the bottom of the foot. And what the difference is that the skin below this has got a slight red color to it, whereas above it, it's got more of the color of the person's skin, which in this case is a more brown color. So we're looking for this junction here when we're locating this point. And then the indications for this point, it can be used for abdominal distension, epigastric pain, constipation, vomiting, and diarrhea. It can also be used for febrile diseases and anhidrosis. Our insertion is perpendicular, 0.3 to 0.5 cun. The next point we're going to look at is Yinbai, spleen 3. So this is a shoe stream, yuan source, and earth point of the meridian, and it is located on the medial side of the foot, proximal and inferior to the first metatarsal phalangeal joint, at the junction of the red and white skin. So this is very similar to the location of spleen 2. The only difference here is it's proximal instead of distal. So once again, we do exactly the same as spleen 2, locating the metacarpal phalangeal joint over here. And this time we need to go this direction as it's proximal. So it's towards the center of the body instead of away from it. And then once again, we're going to locate that red and white skin that we talked about, which is around this region here. So the indications for this point. So if we look at this point, it's firstly a yuan source point. And what the yuan source points are used for is that they're used to treat disorders of their associated zang or fu organ. So in this case, it's disorders of the spleen organ. And as we talked about earlier, the spleen organ is responsible for the digestive functions of the body. And therefore, dysfunction in the spleen organ will be seen in a whole variety of disorders related to digestion. So this point can therefore be used for any of the following symptoms if they are due to the dysfunction of the spleen organ. This is symptoms such as abdominal distension, epigastric pain, constipation, dysentery, vomiting, diarrhea, and borborygmus. And then secondly, the second indication here refers to this point being able to be used for fatigue of the limbs and heaviness of the body. And why this point can be used for these two symptoms is down to the function of the spleen organ. So firstly, if you think back to your theory lectures around the Zhang Fu organ theory, can you remember what the constituent of the spleen is? So the spleen's constituent is the muscles, and it's also the four limbs. So therefore, when we see fatigue of the four limbs, this usually indicates dysfunction of the spleen organ, as the spleen organ governs the limbs. And therefore, this point can then be used to treat fatigue of the limbs due to the spleen qi dysfunction. Secondly, the heaviness of the body. So if we think about the functions again of the spleen, so the spleen is responsible for the transformation and transportation of the foods and fluids that we eat. So if the spleen is dysfunctional, the foods and fluids will not be transformed and therefore will start to accumulate in the body. And the accumulation of fluid is another name for internal dampness. And if there is accumulation of dampness in the body, one of the signs of this accumulation will be heaviness of the body. As if you think of any type of container, it is always heavier when it's full of water compared to when it only has a little bit of water in or is empty. And therefore, that's why this point can be used for heaviness of the body due to dampness from an underlying deficiency of the spleen. Our insertion for this point is perpendicular, 0.5 to 1 cun. The next point is Chongxiang, spleen 4. So this point is a Luyue connecting point and confluent point of the thoroughfare vessel. It is located in the depression, distal and inferior to the base of the first metatarsal bone, at the junction of the red and white skin. So similar to spleen 2 and spleen 3, it's at the junction of the red and white skin. But here we at the base of the first metatarsal, instead of being at the junction of the metatarsal phalangeal joint. So this is the base, referring to this portion. And then what we've got to do is we've got to go distal and inferior. So that's inferior is this direction, distal would be towards the toes, and that puts us in this region. And where in this region we're going to be is based on where the junction of the red and white skin is on this point. So the indications for this point, when you think of the indications for this point, remember that this point is a Luyue connecting point and therefore can treat dysfunction of both the spleen and the stomach organs. So therefore it can be used for conditions that are due to either dysfunction of the spleen or stomach organs. And that is symptoms such as abdominal distension, epigastric pain, vomiting, diarrhea, dysentery, or borborygmus. And it would be used for all of these symptoms if they're due to this dysfunction of the spleen and stomach. Then this point can also be used for insomnia, irritation, mental disorders, and qi rebellion. Our insertion is perpendicular, 0.5 to 1 cun. The next point is Shangqiu, spleen 5. This is a Jing River and metal point of the meridian. It is located in the depression, distal and inferior to the medial malleolus, on the junction of the lines drawn from the anterior and inferior borders of the medial malleolus. So you're going to locate the medial malleolus over here. What we're going to do then is we've got to locate its anterior border, which is around this region. And then we've got to locate the inferior border down here. And where these 2 points meet, there is a depression, and this point is located in that depression. The indications for this point, it can be used for abdominal distension, constipation, diarrhea, and borborygmus. It can also be used for jaundice, and locally for pain of the foot and ankle. Our insertion is perpendicular, 0.2 to 0.3 cun. The next point is Sanyin spleen 6. So firstly, let's go into the location of this point. So this point is on the medial aspect of the lower leg, 3 cun superior to the prominence of the medial malleolus, posterior to the medial crest of the tibia. So we first locate the medial crest of the tibia, which is level with spleen 9. Then we locate the medial malleolus down here, and this distance is 13 cun. And then we're going to divide this distance into 3 equal parts, and then this will put us 4 1/3 of a cun superior to the medial malleolus. So then we've got to go 1 1/3 of a cun down to where this point is located. Next, let's look at the indications. So firstly, this point is known as Sanyin Jiao. So the meaning of this word is quite useful in remembering the functions of this point. So firstly, San means 3, Yin means yin like yin and yang, and Jiao means intersection. So it's the 3 yin intersection, which refers to it being the intersection point of the 3 yin meridians of the foot. And then the 3 yin meridians that meet at this point are the spleen, the liver, and the kidney. And this is very important, as this tells you and explains to you why it can have so many indications as it does. So firstly, if we look at the first indication, this point is on the spleen meridian and therefore can treat dysfunction of the spleen organ, and that is why it can treat conditions such as abdominal pain, distension, diarrhea, and borborygmus, all due to dysfunction in the spleen organ. Then secondly, it can be used for dysfunction in the female reproductive system, and this is due to 2 reasons. Firstly, if we think about the pathway that this meridian flows, if you remember on the lower abdomen, it moves medially to REN 2 and REN 3, and both of these points are very close to both the male and female reproductive organ. So that is one reason why it can treat these types of disorders. Secondly, it can also treat these types of disorders due to the fact that many of these reproductive dysfunction disorders are due to either dysfunction of the spleen organ or the kidney organ. And because this point is on both the intersection point of the spleen and the kidney meridian, it can therefore be used for any of these disorders such as irregular menstruation, dysmenorrhea, uterine bleeding, etc., all due to either dysfunction in the spleen or the kidneys. And then for the same reasons, because it is the junction point of the spleen, the kidney, and the liver, these 3 organs are important in the dysfunction of both the male reproductive system, so for conditions such as nocturnal emission and impotence, but also for disorders of the bladder. And that is why it can also be used for the indications in point 3, which is enuresis or dysuria, as the main culprits when you see these types of conditions are usually the spleen, kidney, or liver. And then the same reason for point 4, palpitations in insomnia. It's referring to palpitations or insomnia due to either liver, kidney, or spleen dysfunction. And these are common causes of either palpitation or insomnia. And then the fifth indication, it can be used for muscular atrophy, motor impairment, paralysis, and pain of the lower extremities. So this is its local function as it is located on the lower extremity. And then its final indication, point 6, is it can be used for yin deficiency. The reason why it can be used for yin deficiency is because it's the intersection point of the 3 yin meridians on the foot. And these 3 yin meridians are very important in the normal functioning of our yin. Our insertion is perpendicular, 1 to 1.5 tsun. And the important thing to note here is this point is contraindicated during pregnancy. The next point we're going to look at is Luao Gu, spleen 7. This point is on the medial aspect of the lower leg, 3 tsun superior to spleen 6, San Yin Jiao, or 6 tsun superior to the medial malleolus, in the depression posterior to the medial crest of the tibia. So how we locate this point? So we first locate the lower border of the medial condyle of the tibia, which is level with spleen 9 over here. And then we find the medial malleolus down here. We divide this distance in half, which gives us 6.5 tsun, as the total distance was 13 tsun, and then we go half a tsun inferior to this. This point is indicated for abdominal distension, bulborhynchus, dysuria, seminal emissions, and numbness or paralysis of the lower extremities. Our insertion is perpendicular or oblique insertion, 1 to 1.5 tsun. Our next point is DG, spleen 8. This is the she cleft point of the meridian. It is located on the medial aspect of the lower leg, 3 tsun inferior to spleen 9, in the depression posterior to the medial crest of the tibia. So how we locate this point is we first find spleen 9, which is at the lower border of the medial condyle of the tibia, around here. We then locate the medial malleolus down here. And then we divide this distance into thirds. Each third will be 4 1/3 of a tsun. And then we're going to go 1 1/3 of a tsun superior to locate this point. This point is used for dysmenorrhea, dysentery, irregular menstruation. It can also be used for abdominal distension and diarrhea. And thirdly, for dysuria or edema. Our insertion is perpendicular or oblique insertion, 1 to 1.5 tsun. The next point is Yinling Quan, spleen 9. This is the Hersey and water point of the meridian. It's located on the medial aspect of the knee, inferior to the medial condyle of the tibia, in a depression in the posterior groove of the medial border of the tibia, level with GB34, which is known as Yangling Quan. So we're on the medial aspect of the knee, inferior to the medial condyle of the tibia. Here's the medial condyle. And then it says we're in the depression on the posterior groove. So what it's referring to, this groove here, this groove will be facing posteriorly, so it'll be facing towards the back of the body. So that's why they call it the posterior groove. And it's on the medial border of the tibia, which is this portion of the tibia. So we locate this groove, and then we're going to be in a depression just inferior to this point. This point can be used for a variety of conditions, but most commonly is used for conditions of excess phlegm. So when we're treating conditions such as abdominal distension, diarrhea, edema, jaundice, or dysuria, we would use this point when we see a preponderance of phlegm as the main presentation of the patient. But there could be an underlying deficiency of the spleen as well, but what they're presenting with mainly is that of excess dampness or excess phlegm. We will then use this point, Yinling Quan. This point can also be used locally for knee pain. Our insertion is perpendicular, 1 to 2 tsun. Okay, so our next point is Shu Hai, spleen 10. So this point is located on the anterior thigh, so we're now above the knee, 2 tsun superior to the medial border of the patella. So if you think back to the stomach slides, remember they were all level with the lateral border of the patella. So now we're going to go to the medial border over here. And then from the medial border, we need to go 2 tsun superior. and it's in a depression in the bulge of the vastus medialis, directly superior to spleen 9, and there's a simple method of locating this point. So firstly, what you got to do is, here's the medial border of the patella, over here, and then to get the 2 tsuen above that, what you can do is you can take the distance from the top of the patella to the bottom of the patella, that's measured as 2 tsuen, and then you can add this distance above the superior border. So we take this distance and put it here again, and that'll give us 2 tsuen above the patella. And then where along this line you need to be, that's what you do is you have to find the bulge of the vastus medialis, which means the center of the muscle. And if you see here, this is the muscle, and then we're going to be in the center, which would be around here. So there is also a simple way of locating this point, and the simple method is actually preferable to the other method when locating this point, as the other method is quite complicated. So what you're going to do is, if you look at the image I've just brought in now, what you're going to do is you're going to grasp the kneecap with the palm of your hand. So the kneecap would be around this region. So you can see this hand, the palm is right over the kneecap. And then where the thumb lands, the tip of the thumb, that is where this point is located. So this image here on the right is actually how you would locate it on the left leg. So you would use the right hand on the left leg. But in this image here, we'd have to use the left hand, and then the thumb would go more this way. And then where the thumb landed is where this point is. The indications for this point. So this point is a special point in the fact that it is very good for treating bleeding disorders. And there are 2 specific types of bleeding disorders it can treat. Those are gynecological bleeding disorders, and this is number 1 in this slide, such as irregular menstruation, dysmenorrhea or amenorrhea, and then also dermatological bleeding disorders, and that's point 2, which is things like urticaria, eczema, and erysipelas. And you might think that some of these aren't actually bleeding disorders, but sometimes a bleeding disorder could be something like blood heat, and then our presentation might just be a rash that has very bright red dots. And then even though the patient is not actually bleeding, this is still considered a bleeding disorder. And then finally, because there are not many points on the body that can treat the blood directly, this point is often used for all types of bleeding disorders, regardless of the cause. Our insertion for this point is a perpendicular insertion, 1 to 1.5 tsuen. Our next point is G-men, spleen 11. So this point is located on the medial aspect of the upper leg, on the line connecting spleen 10, shu high, to spleen 12, and it's 6 tsuen superior to shu high, spleen 10. So what does this mean? Well, what we first got to do is we first got to locate the 2 points used to find this point. So spleen 10, as you mentioned before, you're going to use that simple method, locate spleen 10 over here. Then we got to locate spleen 12, which we'll learn about next, which is around up here. And what we do is we draw a line between these points, as you can see over here. And then how we get the 6 tsuen above spleen 10 is that if you remember the distance from the superior border of the pubic symphysis to the superior border of the patella is 18 tsuen. So what we'll do is we'll take this distance and then we will divide it in half. That will give us 9 tsuen, and then we just have to go 1 tsuen inferior. If you're wondering how you would go 1 tsuen inferior, what you do is that you use your eyes to estimate what 1 tsuen would be. So in your mind, what you would do is you would take the distance from here to here, and you would divide it into 9 equal parts in your mind. And that would then give you the estimate of what 1 tsuen would be, and then you can go down by that portion, ensuring that you're still on this line. This point can be used for dysuria and enuresis, and then locally it can be used for pain of the medial aspect of the thigh. Our insertion is perpendicular or oblique, 0.5 to 1 tsuen. And then the caution here is against deep needling, as this may puncture the femoral artery. If you look at the image I've just brought in on the right, as you can see, here's the femoral artery running here. And if we locate this point again, here's spleen 12 up here, down here is spleen 10. We draw a line between these points, and we go 6 tsuen above it, putting us over here. As you can see in this particular individual, it would lie directly above the femoral artery. And that's why we've got to be very careful on our depth, to not exceed this depth. even though this point is going into the muscular portion of the legs, the depth is much shallower. So this is good to note. Our next point is Chongmen, spleen 12. This point is lateral to the groin region, 3.5 cun lateral to the midpoint of the upper border of the pubic symphysis, on the lateral side of the femoral artery. So what you have to do is you have to first locate the superior border of the pubic symphysis over here, and then we're going to go 3.5 cun lateral to this. So how you would get your 3.5 cun measurement is that what you would do is you could use the midpoint of the clavicle up here at the top of the patient, and we will follow this midpoint all the way down like this, and then we just go down like this, and then we just go half a cun medial to this. And once again, you could eyeball this by dividing this distance from here and here into 4 equal parts like this, and then we know we're going to be half the distance of one of these parts, as one of these parts would be 1 cun, and we need to go half a cun in. So we just go half like that. Then once you feel like you have located the point correctly, you need to make sure that you're on the lateral side of the femoral artery. So how you would do this is you need to palpate and make sure that you can feel the femoral artery in this region. This point can be used for hernias, abdominal pain, metorrhagia, metrostaxis, leukorrhea, and vaginal discharge. Our needling is a perpendicular insertion, 0.5 to 1 cun, and our caution is against deep needling and needling in a medial direction, as both may puncture the femoral artery, and also against needling in a lateral direction, which might puncture the femoral nerve. And I've brought in this image to show a more anatomically correct view. So our point is going to be located in around this region, and then we'll palpate for this femoral artery to make sure that we're on its lateral side. The next point is Fushi, spleen 13. This point is lateral to the groin region, 4 cun inferior to spleen 15, Daheng, and 0.7 of a cun superior to spleen 12, Chongmen. 4 cun lateral to the midline. So now we're on those points that we talked about earlier on the chest and abdomen, which all share a similar location. And for the points on the lower abdomen, they were all 4 cun lateral to the midline. So once again, we'd have to locate the midpoint of the clavicle up here and follow that line all the way down. And then where on the abdomen it is, we know it's 4 cun inferior to spleen 15. Spleen 15 is level with the umbilicus. So what we got to do is we got to take this distance from the umbilicus to the upper border of the pubic symphysis over here. And we know this distance to be 5 cun. So we divide it into 5 equal parts. And then we're going to go 1, 2, 3, and 4 cun down. And then we'll draw a line from this 4 cun mark. And where this line meets the 4 cun mark over here is where this point is located. This point can be used for abdominal pain and masses and hernias. Our insertion is perpendicular, 1 to 1.5 cun. Our next point is Fuji, spleen 14. This point is on the lower abdomen, 1.3 cun inferior to spleen 15, 4 cun lateral to the midline. So we're on that 4 cun line again, and this time we need to go 1.3 cun inferior to the umbilicus. So how you would find this is divide this distance between the umbilicus and the superior border of the pubic symphysis into 5 equal parts. 1, 2, 3, 4, and 5. And then we're going to go 1 cun down, and then we can eyeball the distance from here and here and divide it again into 3 equal parts. So we're going to go to the first third, and then we can take this line and connect it to that 4 cun line. Where these two connect, that's Fuji. This point can be used for abdominal pain and diarrhea or for hernias. Our insertion is still perpendicular, 1 to 1.5 cun. The next point is Daheng, spleen 15. This point is located on the abdomen, and it's 4 cun lateral to the center of the umbilicus. So you locate the center of the umbilicus, and you're just going to go 4 cun lateral to that. This point is indicated for abdominal pain, diarrhea, and constipation, and our insertion is perpendicular, 0.5 to 1 cun. The next point is Fu-I, spleen 16. This point is on the upper abdomen. We're still 4 cun lateral to the midline, but this time we got to be 3 cun superior to spleen 15 or the umbilicus, as they're both in the same position. And how we find that 3 tsun? We've got to find the sternocostal angle up here. And we've got to find the umbilicus. This distance is 8 tsun. We're going to divide it in half. And then we're going to go 1 tsun down. And how we do that 1 tsun is we eyeball this distance from here to here. And we know that there's going to be 4 tsun in this distance. So we divide it into 4 equal parts like that. This is all done in your head. And then we're going to follow this first part down like this. Then we just got to connect this line with 4 tsun line from the clavicle. And that's where this point is located. This point can be used for anorexia, abdominal pain, constipation, and dysentery. Our insertion is perpendicular, 0.5 to 1 tsun. And then our next point is Shiduo, spleen 17. So you remember that this is the first point that's no longer 4 tsun lateral to the midline. It's now moved 6 tsun lateral to the midline. And this point is located in the 5th intercostal space. So here's the 5th intercostal space. And then we've just got to go lateral until we're 6 tsun lateral to the midline. This point can be used for the sensation of fullness in the chest and hypochondriac region, regurgitation and abdominal distension, or for edema. Our insertion here is an oblique insertion laterally, 0.3 to 0.5 tsun. And remember, this is because this point lies over the lungs, so we cannot do a perpendicular insertion. And you'll see this in the caution. The caution is against perpendicular insertions, especially in thin patients, as this carries a significant risk of puncturing the lungs. The next point is Tianci, spleen 18. This point is on the chest. Just like the previous point, 6 tsun lateral to the midline, we're now in the 4th intercostal space. Here's the 1st intercostal space, 2nd, 3rd, 4th, and then we've got to go 6 tsun lateral to that. This point is used for chest pain and cough, acute mastitis, and hypogalactia. And these are all because of its location being close to both the chest and the breasts. This point is also an oblique insertion in a lateral direction, 0.3 to 0.5 tsun. And the same caution as the previous point against perpendicular insertions, as they carry the risk of causing pneumothorax. The next point is Chongxiang, spleen 19. This point is on the chest, still 6 tsun lateral to the midline, but we're in the 3rd intercostal space over here. This point is used for the sensation of fullness in the chest and hypochondriac regions. Our insertion is oblique in a lateral direction, 0.3 to 0.5 tsun. And remember the same caution against the perpendicular insertion as the previous 2 points. The next point is Jiaorong, spleen 20. This point is still 6 tsun lateral to the midline like the previous, except it's now in the 2nd intercostal space. So here's the 1st space, we're in the 2nd space, and we're 6 tsun lateral to the midline. This point is indicated for cough and the sensation of fullness in the chest and hypochondriac region. Our insertion is exactly the same. It's an oblique lateral insertion, 0.3 to 0.5 tsun, and that same caution against perpendicular insertions. This point is Dabao. So remember that this point is different from the previous points, as we were going up here at the 6 tsun mark, and now it's come back down, all the way back down to the 7th intercostal space, and we're now at the mid-axillary line. So we're no more 6 tsun lateral. What we're going to do is we have to locate the mid-axillary line over here, and we've got to make sure we're in the 7th intercostal space, this space over here. And then if you look at the image on the right here, it just shows you how to find the mid-axillary line. So the mid-axillary line is midway between the posterior axillary line over here and the anterior axillary line. We find these 2 points, and then we go midway between them, and that's our mid-axillary line. This point can be used for tachypnea, fullness and pain in the chest and hypochondriac region, general pain, chest pain, and tiredness of the limbs. Also, I want you to note here that it's a great Luyue connecting point of the spleen, and that the insertion is an oblique insertion laterally, 0.3 to 0.5 tsun, just like all the previous points. And remember the same caution here against perpendicular insertions. And that's the end of the spleen meridian. Thank you for watching.